Welcome to the NPERS Social Security presentation. This presentation is designed to give you a broad look at the Social Security program as it's a basic part of many people's retirement plans. During the presentation, I'll go over what makes you eligible for Social Security benefit, how to calculate that benefit, and various other aspects of the program. As a side note, NPERS does not calculate or administer Social Security benefits, so if you have a question about this program or about a claiming strategy, please contact the Social Security Administration or a licensed financial planner. Social Security was established as a program in 1935 as part of FDR's package of New Deal legislation and was designed to help retired individuals who were affected by the more than 10,000 banks that failed or by the 25% unemployment rate that was going on during the Great Depression. Social Security is a pay-as-you-go system, meaning that as people pay into Social Security through payroll, FICA taxes, this money is being paid out as benefits to people who are currently receiving Social Security. It's designed to replace a portion of your income, that portion being approximately 40% of your average monthly earnings, although we are seeing that percentage be closer to 30% now. Social Security is a benefit that is paid out for your lifetime, so should you claim at full retirement age, a payment would continue for the rest of your life. That lifetime monthly payment is made according to your date of birth. On the second Wednesday, if you're born on the 1st through the 10th, on the third Wednesday, if you were born on the 11th through the 20th, and on the fourth Wednesday, if you are born on the 21st to the 31st of the month. Social Security has undergone a lot of changes throughout the years. It has grown and expanded into something more than it started to be, as it now encompasses survivor's insurance for families of deceased workers, disability insurance for disabled workers and their family members, and Medicare, which provides health insurance for Social Security beneficiaries. Those beneficiaries being retired persons, survivors, and about a third of them are disabled dependents of those with disabilities. In 2024, Social Security issued about $1.5 trillion of benefits to almost 68 million Americans, and roughly 1 in 4 retirees receive at least 90% of their income from Social Security. So first, I want you to think about your current income. Next, think about what 40%, closer to 30% now, of what that amount is, and ask yourself, could I live on only that amount? Well, that's exactly what 25% of retirees are doing. That is a sobering thought. Additional benefits for spouses, widowed spouses, and children under 18 are available through Social Security. Although we're not going to cover these scenarios in our presentation today, if upon reviewing the slide you believe one of these scenarios pertains to you, please contact the Social Security Administration or review their website at ssa.gov. The contributions to fund the benefits that are paid out by Social Security come from payroll, taxes, or FICA taxes. That's 6.2% of our first $176,100 in earned income. So don't worry, the second $176,100 you earn is safe. There's also an additional 1.45% tax allocated for Medicare on our entire income, and both the 6.2 and the 1.45 percentages are matched 100% by your employer. If you happen to make over $2,000 individually or over $250,000 as a married couple, you are subject to an additional Medicare tax of 0.9%. To be eligible to receive Social Security, you need 40 credits. You can earn a maximum of 4 credits per year, and this is based on annual earnings. Each year, the dollar amount for 1 credit can change. This year, $1,810 equals 1 credit. So if you earn $7,240 or more this year, you've earned the maximum 4 credits. Because you can only earn 4 credits per year, it does take most individuals 10 years to become eligible for their Social Security benefit. Now that we know what makes us eligible to receive a benefit, let's talk about how those benefits are determined. And as we go through this determining benefit slides, please do not write anything down. I'd like you to just listen, as I'll be sharing with you how to set up a personal mySocialSecurity account in a few minutes. That Social Security account will give you much more precise benefit figures as opposed to the quick estimated figures I'm about to show you. As mentioned before, Social Security is used to replace 30 to 40% of our lifetime average monthly earnings. So we'll need to know what our lifetime earnings are. Then we'll need to place those earnings into a formula which determines what percentage we'll receive. And finally, our benefit amount will be greatly affected by when we decide to start drawing benefits. In determining your lifetime earnings, the Social Security Administration looks at your 35 highest years of earnings. Then they apply an indexing factor to each year that brings all 35 years to current dollar values. That's because the dollar you earned in 1990 is worth around $2.41 today. These indexing factors are updated each year. Your 35 highest years of earnings do not have to be consecutive, and the average is going to be decreased if you have lower years of earnings or perhaps years with no earnings at all. Keep in mind, if an individual has less than 35 years of income, the missing years are calculated at 0. Once all 35 of your annual earnings have been indexed to today's value, they determine an average of those 35 highest years of earnings. This average index monthly earnings, AIME, is calculated by adding up the earnings and dividing by the amount of time. By using 420 months, which is equivalent to 35 years, it allows us to get a monthly average. The example used here for lifetime earnings is $1,925,000. If we divide that by 420 months, it gives us $4,583 for our average indexed monthly earnings. Now we need to drop the $4,583 amount into that income replacement formula that I talked about earlier. Remember, Social Security is designed to replace only a portion of our income, so that's what this formula calculates. The lowest replacement formula bracket will replace 90% of that amount, the next bracket 32% of that amount, and the highest bracket will replace 15% of that amount. It's important to note that these income bracket amounts are updated each year. From our example, we came up with average lifetime monthly earnings of $4,583. Let's apply this amount to the replacement percentage formula for 2025. PIA, or primary insurance amount, on this slide refers to the Social Security benefit a person receives at normal or full retirement age. Okay, back to the brackets. The first $1,226 of our $4,583 monthly earnings goes into the first bracket, and we get to keep 90% of that. So let's set aside $1,103.40. Looking at the second bracket, we need to subtract that first $1,226 from our $4,583 lifetime monthly earning amount, which gives us $3,357. We get to keep 32% of that amount, so we'll set aside $1,074.24. If our average monthly earnings were over $7,391, we would only get to keep 15%, but in our example, we didn't make enough to even get to the third bracket. Upon adding the two amounts we get to keep, $1,103.40 from the first bracket and $1,074.24 from the second bracket, that gives us a total of $2,177.64. This $2,177.64 is what our Social Security benefit would be if we claimed at full retirement age. It's important to mention here that the dollar amounts in effect when you turn 62 are what will be used, even if you apply for benefits at a later age. The next thing that determines our benefit amount is when we decide to take our Social Security benefit. Everyone has a FRA, a full retirement age, as determined by the Social Security Administration. And if you review the chart on this slide, it will show you what that age is for you. Now, if you claim your benefit prior to your full retirement age, there is a permanent reduction in your monthly benefit. On the contrary, if you wait until after your full retirement age to claim your benefit, there's an increase in your monthly benefit, but the increase is only up to age 70. Side note, the age reductions and increases are not figured using the same formula. The reduction for claiming your Social Security benefits prior to your full retirement age can be as much as 30% if you claim at age 62. And again, the reduction for claiming early is permanent. However, there are still many good reasons to claim your benefit early, as considering your health, your work, and your family history are critical to determining when you should take your benefit. Someone who has claimed early may receive smaller payments, but perhaps they will receive more of them. The table on this slide shows the reduction percentages for a person who was born in 1960 or later. Thus, their FRA, or full retirement age, is 67, and the reductions shown are based on what age they claim their benefits. Early reductions are prorated by month, so every month a benefit is delayed will slightly lower the reduction percentage. The increase if you claim your Social Security benefit after full retirement age is approximately 8% if you wait until after age 67. However, like I said earlier, after age 70, the benefit amount will not increase. So if you're waiting to take your benefits, please make sure that you don't wait past age 70. This graph is a good representation of how the reduction and increase in benefit amounts can be affected by when you claim them. In this example, a normal benefit at full retirement age is $1,000. If a person claims at 62 with a 30% reduction, then their benefit amount would be $700 a month. Conversely, if they wait until age 70 to claim their benefit, then the monthly benefit would be $1,240. When to take a benefit is a personal choice that should be based on your individual financial situation. I should also mention that if you're trying to add new highest salaries or highest years of earnings to your 35 highest years by continuing to work past 70, you will be increasing your benefit. This could be one advantage to working longer, in case anyone was wondering. Another increase to your benefit is the COLA, or cost of living adjustment. The COLA is 2.5% this year, and that's based on the Consumer Price Index, or the CPIW. Of importance here is that eligibility for COLA starts at the year you turn 62, even if you do not claim benefits at that point in time. Let's talk briefly about the earnings test reduction. The earnings test reduction is only going to apply to certain individuals, those who have applied and started taking their benefits early and have continued to work, thus still earning. Now, this does not include any retirement income that you may be getting from a pension plan, say like an NPERS annuity. Also, good news is that the earnings test reduction is not a permanent reduction, as once you reach full retirement age, the earnings reduction will no longer apply to your benefit, meaning at full retirement age, your benefit will be recalculated and what had been withheld will be put back into your benefit amount moving forward. Very important to note here is that if you are working before full retirement age, you are the one responsible for reporting the need for this reduction to the Social Security Administration. In 2025, the earned income limit is $23,400. So if you choose to take your benefit early and you work a job where you happen to earn over $23,400, then for every $2 over that limit, Social Security is going to keep $1 from your benefit. If you happen to earn $62,120, then for every $3 over that limit, Social Security will keep $1 from your benefit. Remember, this reduction goes away once you hit full retirement age. Let's look at an example of the lower limit to help better understand the earnings test reduction. If your Social Security benefit is $1,000, you're taking this benefit prior to your full retirement age, then you continue to earn an estimated $26,200 of income this year, you will need to subtract the earned income limit of $23,400 from the $26,200 you earn, which gives you an overage of $2,800. Now remember, Social Security is only going to withhold $1 for every 2 that you're over the earnings test reduction limit. So divide the $2,800 overage by 2. That gives you a reduction of $1,400. Something important to note is that the Social Security Administration will withhold an entire benefit payment to satisfy a reduction. So if your benefit is $1,000 a month, then, in this scenario, they will withhold 2 full benefit payments and the remaining $600 will not be returned to you until the next year. Social Security does not take partial payments. The earnings test reduction, as mentioned before, no longer applies once you reach full retirement age and is not permanent, as opposed to the overall reduction for taking your benefits early, which is permanent. Let's talk about taxes on Social Security at the federal level for tax year 2025. If your combined income falls between $25,000 and $34,000 as an individual, and between $32,000 and $44,000 as a married person, then 50% of your benefit is subject to federal income tax. If your combined income as a single filer is more than $34,000 and more than $44,000 as a joint filer, then 85% of your benefit is subject to federal income tax. To figure out combined income, you need to know your adjusted gross income, or AGI. You also need to know what half of your annual Social Security benefit is. And then you need to know if you're going to have any non-taxable interest. Non-taxable interest is generated by things like municipal bonds, so it may be uncommon for some of you. Remember, the earnings reduction test does not include annuity payments from your NPERS plan, since that's not earned income. But we're talking about AGI, adjusted gross income, when it comes to figuring out combined income, and that will include retirement and pension payments. Again, AGI, adjusted gross income, used to calculate total combined income will include payments from an NPERS annuity. In this example, I'll use AGI of $30,000, an annual Social Security benefit of $18,000, so half of that will be $9,000, and no taxable interest. Adding these all together, 30 plus 9 plus 0, gives a calculation of $39,000 for combined income. Now let's take the $39,000 of combined income back to the brackets for taxation that were shown on a previous slide, the 50% versus the 85%. Because this individual earned over $34,000 of combined income, 85% of their Social Security benefit is subject to income tax. If we take their adjusted gross income and add that to 85% of their annual Social Security benefit, we get $30,000, their AGI, plus $15,300, which is 85% of their annual $1,800 Social Security benefit, for a total taxable income of $45,300. This $45,300, that amount determines which income tax bracket they will be paying taxes from and is used for example purposes only here. Moving on to state taxes, good news. As of 2023, during the legislative session, Nebraska voted to no longer tax Social Security benefits. When talking about Social Security, the subject everyone wants to discuss is solvency. You want to know, will Social Security still be around when I'm ready to take benefits? One factor affecting solvency of Social Security is life expectancy. Back in 1940, the life expectancy of a retiree was age 79. Today it's closer to 85, and the number of retirees will increase to about 77 million by 2035. Another factor is that Social Security was expanded to provide additional benefits. And finally, more and more members of the baby boomer generation are taking their benefits from Social Security. However, a 2020 Pew Research study indicated that millennials in the workforce have outnumbered the baby boomer generation 72.1 million to 71.6 million, and Gen X at 65.2 million is projected to pass the boomers by 2028. This is a good thing, as it means we'll still have payroll, FICA taxes coming in to be distributed out as benefits. If Congress does nothing, according to the Social Security Administration, after the depletion of the Reserve Trust Fund in 2035, continuing income would be sufficient to pay 83% of program costs, with a projected 3.5% shortfall of taxable payroll over the next 75 years. Congress has done some things to help with the solvency of the Social Security program already, such as they've increased the full retirement age to 67 and they're taxing the Social Security benefits. Remember, those percentages being either 50% or 85% as determined by combined income amounts. Now, a few additional things Congress could change. They could increase the FICA taxes by increasing the tax percentage, the 6.2% discussed earlier, or increase the income cap, the $176,100 also discussed, which was increased by $7,500 as compared to 2024. They could choose to increase the full retirement age again, making it even higher than 67, or they may just decide to decrease benefits altogether. Any of these things could make the Social Security program more solvent. Another thing that could be changed or adjusted to help the solvency of the program would be the cost of living adjustment, or COLA. Earlier I mentioned COLA being attached to the CPI, particularly the Consumer Price Index for urban wage earners and clerical workers, the CPIW. With the CPIW, we're looking at the prices of a large basket of goods and services. Things in this basket can be a haircut, a gallon of milk, or a price of a tank of gas. All these things are then measured against the very same basket containing the very same goods and services from the previous year. This gives us an idea of what inflation might look like. Now we could use the change CPI or the CPIU to figure COLAs for Social Security benefits instead. The CPIU looks at the same basket of goods and services. However, it considers that when a product or service becomes too expensive, people may choose to substitute a cheaper version of that good or service. For example, let's say you go to the store to buy Lucky Charms, but unfortunately when you go this time, they've gone up $3 a box. True story, my husband loves Lucky Charms, but if they cost $3 more a box, I'd probably tell him to look at the shelf below and buy the unlucky, just kidding, the store version instead. This would be a substitution, and with these substitutions considered, the CPIU would decrease the number of COLAs in general. Finally, we could also use the CPIE. The CPIE is an important difference in that it takes into consideration households who have an individual that's 62 years of age or older. What good or service do you think a 62-year-old would spend most of their money on? That would be healthcare. And once healthcare costs are taken into consideration, it's a good guess that using the CPIE to calculate COLAs would most likely increase them. Okay, remember I said I would show you how to create a mySocialSecurity account? Well, in addition to being so much easier than trying to do all the calculations I just reviewed, creating your own mySocialSecurity account allows you to be able to get a personalized retirement benefit estimate with your specific information, your numbers and wages, and no need to keep up with all the figures that change annually. Simply go to www.ssa.gov, scroll to the bottom of the page, find the box titled My Social Security, and click on Learn About Your Account. It'll take you to a page that looks like the one showing. Let's review the steps on the following slides. When you create a My Social Security account, you'll be able to get instant personalized retirement benefit estimates, review your earnings history, apply for benefits online, and you can also review your annual statement. Important to note, if you do not create an online account, annual statements won't be mailed out to you prior to age 60. To create a mySocialSecurity account, you need to be at least 18 years of age, have a valid email address, and have a valid Social Security number. Social Security would ask that you only create an account for yourself and not anyone else, even if you have their permission. This is to help cut down on fraud. When you visit socialsecurity.gov/myaccount, you'll need to select the Create an Account button. Then you'll be asked to create a credential with login.gov or ID Me. If you already have one of those credentials, simply select the appropriate access button. For those of you who do not have a credential yet, select the link for login.gov to create one. Upon creating your new login.gov credential, you'll still need to provide some personal information. This is needed to verify your identity and receive an activation code. Then just read and agree to the terms of service prior to accessing. Once your mySocialSecurity account is created, you can choose email or text to receive notifications. The whole process really is quick and simple. Once you create your account, at the top of the page will be your personalized estimate of benefits. As you can see via the example on this slide, the estimator gives an estimate of what would benefits be at early retirement age of 62, at full retirement of 67, and what they would be waiting until 70 to get a benefit. You can create customized estimates for your benefits as well. For example, let's say you're 65 years old and you're ready to retire. You're going to take your NPERS benefit, but you want to wait until you reach full retirement age to take your Social Security. You can put in the estimator that you plan on earning $0 from the time you're 65 until you reach full retirement age. It will then adjust your estimate based on that information. The way the information on this slide is listed shows $0 for annual earnings on the top, earnings of $55,000 annually in the middle, and on the bottom in white, it's showing this person's earnings based on the prior year. To generate the estimates, you'll need to enter your future yearly earnings. This should be an annual amount. Now, why is it asking for this amount? Well, it's because the estimator is guessing that you're going to be making last year's reported earnings all the way up until you claim Social Security benefits. And for most of us, that may not be the case. The arrow on this slide is showing where you need to input the annual amount you anticipate earning. This amount could be $0 if you choose not to work at all after retirement. It could be half of what you made the year prior if you decide to work part-time, or maybe it's more. The point is, your annual earnings after retirement will probably fluctuate, and it's important to change that dollar amount so you get the most accurate benefit estimate possible. You can also apply online for benefits if you have a mySocialSecurity account, as long as you're at least 61 years and 9 months old, you're not currently getting benefits on your own record, you haven't already applied, and you want to start your benefits no more than 4 months in the future. Timing your benefit payment is important, and you want to try to avoid any gaps in your income, as your first check won't arrive until the month after the one you pick in your application. The example listed on this slide shows timing for receiving a first check in April. You can apply in November, December, January, February, or March, but you need to pick March on the application. That is what will trigger you getting your first check in April. You can start a new application after you review the information needed. Remember, you will be asked to create a mySocialSecurity account to apply online, but the good news is you can save your application progress. Maybe you have all the information and the time to complete it all at one setting, or maybe you forgot something or something interrupts you while you're filling it out. You can simply save it and come back to finish it later. If your preference is to apply in person, here are the phone numbers to all the Social Security offices in the state. Just call the one closest to you to set up an appointment. I've also listed the national Social Security number in case you don't have a local office. I hope this presentation has been helpful, and thank you for joining me.